Chad Evans back in the studio again with my friend Adam Rosinski. What's up, pal?
How are you?
Good to see you.
You too.
You're a pharmacist.
I am.
How did that happen? You're a Cole Region guy, along with myself.
I went to high school.
You went to
Cole
high
region.
school in the Cole region,
Yes.
and you're here now. You own a couple of things, but mainly we're talking about custom care pharmacy. I see the cars all over the place. You surprised me when you said you only have 7 cars. Because
7 on the road at one time.
At one time, yeah. But you're busy. You're a busy cat.
We are.
Yeah. Was it always your dream to be a pharmacist?
So I grew up, like, my parents were pharmacists.
Yeah, okay.
So I come from a family, like, my parents were both pharmacists. My uncle was a pharmacist, and my sister's a pharmacist. So, like, it's just been a line of pharmacists that have, like, come from the family. We even have, like, relatives who were pharmacists in other countries. So, like, we have one of my distant relatives is a pharmacist in Brazil. I have one that's a pharmacist in Italy. Like, there's just some, like,
I don't think I've ever known
I
that.
know, it's an interesting thing, but like, and like some were before and some were after.
Yeah.
And actually one of my mom's Italian descendants was a pharmacist before her as well. So I don't know, and like how, like I saw my parents do the job, and like what had really happened was I just kind of like one day it's like, come work in the pharmacy. I'm like, okay. And so I actually started at CVS way back when.
Really?
So my first job in a pharmacy was, it might have been Ray and Derrick still. And it was like just like stocking the shelves,
Yeah,
or ringing the register. It all started up front in regular like retail store environment, and then they didn't really let a 15-year-old back into the pharmacy. But when I was like at a certain point, it was about 16, like I like got into like the pharmacy.
Okay.
And like when I used to work up front, I would be like sitting there like watching the clock. I'm like, oh my God, is it time to go yet? It's like you're just sitting there like waiting for the time to pass is what would happen. And then I got into the pharmacy and they would be like, yeah, it's 9 o'clock, let's go. I'm like, what? What happened? Where'd the time go? Like, it was like, and that's when I kind of thought, well, this is a good fit. If like, so it seems it was like a natural fit to me. I was like, well, time is like, just like whew, flying by. I'm not watching the clock. I just like it.
yeah.
And that's when I decided like, oh, well, pharmacy school is probably a good idea for me. I had thought about going to medical school.
Okay.
Like was my other idea. And then like I just chose a pharmacy, and it was actually, there was a security feature to it, because when I applied to pharmacy school and I got into the program, I was guaranteed to get into the pharmacy program after 2 years, as long as I maintained certain grades. Where the medical school system was, I would have to go get an undergrad degree, and then you're like, hopefully I get into medical school.
Yeah.
So I did kind of go down a path of like, well, I know this is secure, so I'm going to go this way. So that's why I ended up choosing pharmacy in the end. I liked the time, I liked how it felt, and then there was a security feature, and like, well, I got in, all I have to do is maintain a certain GPA, and I'm going to have a pretty valuable degree.
It just made sense for you. Yeah.
Yes.
Yeah. But you're more than just a pharmacist. You're also an entrepreneur.
I am.
Custom care pharmacy.
I am.
So you said that started about 13 years ago?
I believe it's 13
Something like
years
that?
ago. I should know that off the top
Yeah.
of my head tonight.
Around there.
Oh, yeah.
But custom care, that's a brilliant name. And you found it, and you have it, and you own it.
Yeah, I had great aspirations for custom care. I still do.
It's so when you decided to open up a pharmacy, you decided to open up around here in the Susquehanna River Valley, in this area. Or tell us about that.
I had always been interested in independent pharmacy, even when I was in high school, and like there were other independent pharmacies in the area. And actually, the medical center was the one in Sunbury, and I remember thinking, "Oh man, I wish I could own a pharmacy like that one day." And funny enough, I actually do own that pharmacy now, or I own the building now. And we did actually not buy that pharmacy, but we actually bought the building and moved our pharmacy into it at one point. But like I always aspired, and when I was in college, I would gravitate towards independent pharmacy things. Like there was like people would come and talk about independent pharmacy. I would always make sure to go. It wasn't like they showed up and you had to go. It was like, hey, there's going to be a speaker talking about independent pharmacy, and I was there. And then when I was choosing my rotations, I tried to get every independent pharmacy rotation I could get. Like anything that was independent, I was after trying to get it. Where a lot of people might focus on other things like things in the hospital system.
Yeah.
I was focused on things in the independent realm right away.
Well, why do you think that was? Is it like the sweet little cute charm of an independent pharmacy, or was it like why independent?
So there was this. Maybe it's like the sky's the limit.
Mm-hmm.
Like you're not like just like siloed into, like most times it's like it's a pharmacy job. This is where you are financially, and like that's it.
Yeah,
that's your life. And so like I like the opportunity to like the sky's the limit. Like you work hard, you put the time in, you deliver quality, you bring value to the marketplace, and the value gets returned to you. So and the control.
Yeah.
Maybe there's a small control hitting here where I would work for other companies. They would do things and they're large corporations. And I'm like, oh my God, what are they doing? This isn't about the customer. And it's like the way people were treated was a big thing for me. So I would work at like the retail chains, and like you would see how people would get like treated. And it's more like the system's not built right. It's like we could do this better, like, and like make it easier for the customer. And I was like always trying to do that myself, even working for the chains. But it was like the system wasn't set up for it, and like you couldn't like meet certain goals that they had. And so it just didn't feel like I was delivering quality care. It felt like I was delivering like more, it was only focused on the bottom line, not focused on care. And really the name custom care is really devised from like, I like to customize the product to the patient's needs or the facility's needs. Because like a lot of people need it differently. Some like it just depends on where you're at and what your needs are. They can be a little bit different from from people to people, and they're generally vastly different from facility to facility.
Interesting. Okay. So how has it been over the last years working as a pharmacist, having a custom care pharmacy in this area? Talk a little bit about the community and the people that you've helped.
So like our focus is helping them like homebound individuals. So it really started with like a traditional walk-in pharmacy, and we immediately started with like a niche. Like the niche was like packaging the medicine into disposable pill boxes, really is what it was. Because if you're taking 15 pills, it's hard to remember which one to take at the right time. Like we want to make sure you're taking the right medicine at the right time, the right way. So when you get to add a few, like too many pills, it's you need somebody else to help manage that. So like we originally started packaging medicine for people who had trouble managing it or can't leave their house. Like many of our people do not drive, they don't leave the house. So that was the original startup of what we could offer that was different. We couldn't show up into town and just like fill prescriptions like a regular chain or and just like expect to have customers walk in. Why would you come to us? You come to us because we can deliver something to you that nobody else is willing to give you. And it really started with the packaging services. So making sure people are taking all their medicine the right way. And it keeps you out of the hospital. It keeps you out of the nursing home because like there's a high number of people who end up in the hospital or they end up in a nursing home because they can't take their medicine right. Or they have an adverse reaction because they're taking their medicine incorrectly that puts them into the hospital. And then you end up in a nursing home and hopefully you make it home. And it's like you take some medicine wrong, before you know it, it's like, oh, I fell and broke my hip because my medicine was off. So like when you control the medication related issues, you have a better chance of staying in your home. It aligns with the goals of Medicare, hospital systems. Like it's on the same page. Like they don't want you in the hospitals repetitively. If you come back and forth, Medicare is actually like creating a scorecard and dinging the hospital. It's like, hey, this patient came back to you. You didn't do a good job, which is a common setup in other countries. So like in England, the system is set up to pay for quality of service. In the U.S., when it was set up, it was like, how many services can we give? Not like,
I see.
like there wasn't quality metrics put on it. And it's newer in the US that there's quality metrics. We're measuring the quality of the healthcare delivered and reimbursing the system for the quality you provide, not the quantity you provide. So like that is where we come in as an ally. Like we can be an ally to a hospital or a doctor's office or a facility or a patient who wants to stay home. Like if you control your medicine, like if you can take it the right way, there's a good chance you can stay home for many more years if you can't handle that.
Yeah. Wow.
But that was the original intent of like when we opened the pharmacy in the niche. And it just started by a niche, by putting one guy's pills. I remember his name. By putting that man's pills into a package. And then like the nurse was like, wow. And then it was just another one. And like word spreads. It was all word. It wasn't like we were good at advertising or anything. This is like we have mainly grown to this point by mainly word of mouth at this point.
Boots on the ground.
Right. But it's really word of mouth of like friends telling friends, nurses telling nurses, doctors telling doctors, doctors telling patients. But
And it grew into CustomPackRx.com.
yes.
Right. So talk a little bit about that.
So we have really evolved into that we mainly are medication managers. We are, I would call it concierge pharmacy. Like we are delivering services that are just more inclusive of like the whole picture of all of your medicine. And like sometimes there's like, you have multiple providers involved. I might have a cardiologist. I have an endocrinologist. I have a general doctor, a primary care doctor. And like we are like actually the middleman who coordinates all that medication related issues. We are really good at what we do. There is very little that ever slips by us that like you've gotten something wrong. And it's like, it's because we know, we look at your medication profile every month. We look at it and I'm like, oh, that doesn't look right. We should call the doctor on this one. Or it's like something new comes in. Like it would be, the example is like the doctor sends a new prescription for a new medicine. And like when we get that new medicine, we're like, oh wait, which one should not be in there anymore? Are they stopping something? And like in normal circumstances, people might not know, because that's the thing that happens. The doctor might start a new medicine and say, stop taking the other one. But then the people don't, they take both.
Yeah.
It happens.
Yeah.
And like that's the thing where like that something like that comes to us, we evaluate all your medicine, and if we think there's something off about it, we're going to make sure we make sure to clarify what's going on. And that's something that's been tweaked over time. It's honestly has come from mistakes. Yeah. So it's like it would accidentally happen to us. So, oh, that one's not getting past this again. Because you catch me once on something, I'm like, I'm like, you're not going to get me again on that one.
But your headquarters are in Milton, is that right?
Yes.
Okay. And you talk about we, and we care a lot. We care a lot. Can you talk about your team a little bit, and the people that you brought on your team? What kind of personalities do they have? Why do they care so much? Is it the culture of Custom Care Pharmacy? Tell me a little bit about it.
I work on culture all the time.
Yeah.
Culture is a subject that is brought up quite frequently.
Okay.
Because I really want people to be aligned with the goal of helping people. Like the goal of like, you're not here for a paycheck. You're here for like, we are here to help people stay in their homes. We are here to alleviate every medication. Like anything we could do for you on the medication related side, we want to be able to do that from our side. So like we're always working on culture. We're always talking about it. Like a lot of us never see our customer. We might talk to them on the phone. The driver sees the customer. But like that bond with the customer, like that in the traditional setting of them walking into the store, we don't have that because we're coming to a homebound customer.
We're going to take it to you.
Yeah. So like we're always working on it. It's always part of like our initiatives of growing culture and like working on that. It is, I think, something that's it's a great thing for every company to work and talk about culture. And we do have like a large team of people at this point because we are covering a huge service area. Like a lot of people like, oh, it's a pharmacy in Milton, and they can't conceptualize, oh, they're in Philadelphia. What? this pharmacy in Milton is in Philadelphia. What are you talking about? It's like, but it's like, it's hard to understand like a pharmacy that started in a rural community has grown into something that's far bigger than like what people would think, because it's like a hometown. Like it's grown into like from a hometown. It grew out of a hometown pharmacy, right?
Yeah.
It started as a hometown pharmacy to service Milton, and it would be like this person needs help and they live in Lewisburg. This person needs help and they live in Shamokin.
Yeah.
This person needs help and they live in Mount Carmel. Mm-hmm. And it's turned into this person needs help and they live in Coatesville, like which is that city outside of Philadelphia. And like we like keep just growing because of like the quality we deliver, the word of mouth, and we do have a sales team now who is like assisting and getting the word out about who we are and what we do. Because even in Milton, like because we still have a traditional walk-in pharmacy, like even in Milton, people still walk in the door at 13 years, and it's like we never knew you were here. It's like, but when you stop at that red light, do you ever turn your head left? Because it's like, there's a ton of people stopping at that red light, but you don't see it. It's just, you don't know.
Of course.
Yeah.
How is the industry right now of medicine? How is it? What's the state of medicine in the United States of America?
The state of medicine.
Yeah. You know, is it?
I'm almost afraid to show my opinion on that one.
There's
the state of medicine.
Yeah.
The system is difficult to work with. The payment system is particularly difficult in certain settings. But like when people get their medicine, like if they're getting a bunch of medicine, they're getting them in bottles, like they're not served well. And the packaging that I talk about, it's actually really common, and it's been common in Europe for years. So like the US is late to the game in like this is a service that's common. Yeah. So Canada, this has been a thing for like 2 decades, 3 decades. I think it's been a long time. And actually like the materials, products, and things that we get are actually like we actually get them from Canada because like Canada and Europe. This was in Europe before us as well. But like the system of medication and the way it works with insurances, it's difficult, and like it's expensive. Yeah. I mean, the U.S. consumes the majority of the medicine in the world, and like our data and metrics are not there to say we're all healthier than the rest of the world. And like I am a person who says medication is not always the answer. So like I'm not the best person to talk about taking a bunch of medication, because I'm somebody who tells you like let's talk about consumption and diet and exercise over over medicine. Yeah.
So just to compare, and I know or contrast, I should say, and you touched on this a little bit. So what makes custom care pharmacy different than a big giant Rite Aid or a CVS?
The difference is the quality of service you're getting and the global picture. Like we're not looking like those other chains. They're looking at a singular prescription, and they're making sure it's like the right name, the right drug, the right doctor, the right quantity. They're just looking at you're looking mainly at, is this order exactly what
the doctor
is
said
on the bottle, in the bottle? Not a global look. Ours is a global look. You get a new medication from us, we look at it, we're like, have you been on this before? Like, do you have other medicines like this? Like, what's it look like against your entire profile? Like, we're looking at everything from a global picture. So we're not a pharmacy that you want to come to that feels like I just need one medicine here and I get the others somewhere else. Like, that's not, we don't serve you well there. We serve you well, and you come to us, we fill all your medicine, and you have somebody scrutinizing your entire profile every time, and looking for errors, suggestions, improvements. Like, this one's, why would you pay this much for this medicine? You don't need this one. Or there's other cheaper alternatives. Or we're looking at the way you take the medicine. That's a big one. 'Cause compliance is based around ease. So like, it's like people might have 10, 15 medicines and they're like, I think I'm supposed to take it this way. I'm like, no, like, we could tweak it this way. Like now you only have to take medicine twice a day. Or like, oh, I've been taking medicine 6 times a day. It's like, oh, you don't take medicine 6 times a day. I'm like, you're not going to remember. You won't be compliant if you're taking medicine 6 times a day. There's some occasions people need to take medicine 6 times a day. Mm-hmm. They're rather rare. They're more of like a Parkinson's patient who needs like a tremor medicine, like routinely. That's the rarity, and that's somebody we still can serve. Mm-hmm. Like our packaging systems can accommodate anything and any like that. But that's like we can look at it and be like, let's make this as easy as possible. And if there's troubles with cost, let's look at what resources there are to assist with that. Whether it be like assistance from a manufacturer or like a change in, you don't need that in a brand name. We can do this in a generic, and let's see what the doctor thinks.
Well, that's what I want to ask you. Do you get some pushback from doctors? Like if maybe there's a pill that you question or some kind of medicine you question, or you're trying to help understand, do you get pushback from doctors at all?
I feel like back in the day we did. I feel like we don't anymore.
Really?
I don't. I do.
Why is that?
I feel like they know who we are. They
That's
know
great.
what we do. Like that they like when we call with a suggestion, they like are usually like, yes.
You're an ally.
Right.
Yeah.
Right.
You're there to
like,
help them too.
Mm-hmm. Yeah, and like again, we're looking from a global perspective. Generally, that's like not always the case anymore. A lot of people have to get like these in the mail, and I'm getting this at this store, and this over here, and this one from Amazon, and it's like it just like you don't have like a pharmacist case manager. Like you have a pharmacist reviewing your stuff like a doctor. Like, I mean, our pharmacists are doctors. They all like PharmDs. Sure. Like it's a different kind of environment over. We're delivering long-term care services into the community. So we're delivering the kind of service that you would get if you lived in a facility, if you were in a nursing home, if you were in an assisted living facility. We're providing that level of care into a patient's home. And some people might use it because it's convenient. It's easy. I don't have to think about it. But most of our people will like have trouble if they don't use it, meaning like they won't take their medicine the right way. And then before you know it, the doctor wants to add another medicine. It's like, oh, your cholesterol's still not good. We need to add another one. And the patient doesn't say, oh, I never take my medicine. They just like, yeah, I need another medicine. I'm not going to tell the doctor I'm not taking my medicine. Or like they might not even remember. They might not remember. But like that's the thing like that can make the difference of like, well, they start taking the medicine right. Like they don't need another medicine.
How does one get signed up for your help? Do they come walking into your clinic, or is there a caregiver maybe that reaches out to you? How does the whole process start with Custom Care Pharmacy?
So I would say like currently with our current system and network and word of mouth and reputation, most of it stems from a referral.
Okay.
So like, and when I say a referral, it's like mainly it's like a nurse or a doctor or a case manager says like, hey, we think you're having issues here, and we know a pharmacy that can resolve that for you. People are like very hesitant about changing pharmacies, which I think is funny because like when you go to CVS, like I generally think you barely know who the pharmacist is.
Right.
Like and like a lot of times it's like it's always a different person every time I get there, and so I get confused about that. But I mean, I'm like on a different side, right? Of course, I'm biased. Like you should all switch to us. I don't know why you're all not here
What's your problem?
right now. You have no idea. But there's certain, like, and there are plenty of people who do not need us, right?
Okay.
There's like, oh, I take one medicine. You don't need us. You can take one pill out of the bottle just fine. You'll be fine. You don't need me. And like, even when you get up to a couple, but I could tell you, I myself like have to take a blood pressure pill. I have to take like metformin, and like I have my own problems remembering to take my pills. and like
we're busy.
Busy
people.
Yes.
So what's next for Custom Care Pharmacy? Where do you see it, 5 years from now? Still doing the same thing, just with more customers and more relationship-driven culture? Do you have a big plan of attack? What are your thoughts moving forward?
Our thoughts moving forward, are continuing to expand within the state, and in 5 years, I would be looking to have already expanded outside the state.
Right.
So, in the bordering states is our next focus in the next 5 years.
Yeah.
The level of service and what we deliver is still going to come out with our drivers and our network. We're not going to put that into the mail. We're going to show up at your door, and it's like one of the things that happens at our pharmacy that people have trouble understanding or just trouble believing is when you're enrolled in our services, and this is the idea is this is my mom, and it's she went to the doctor, she got a prescription, and they're oh, you need this antibiotic, and mom's homebound, she can't go get it. And it's oh my God, I gotta leave work, I gotta go get this, I gotta figure out how to get this done. It's hey, if we know about that before 6, 7 o'clock at night, it's still making it to your house. We're talking 2 hours away, it's still making it to your house, because we're out there, our hours, we're out there delivering well past well past our closing time. But we're making sure you're taken care of really well in that regards of the level of service you're getting, which is the same level of service a facility would expect. And it's one less thing for caregivers. It's a lot of sons and daughters who had to do this for their parents.
Yeah.
This is a huge burden lift off their back, because it's just one less thing you have to do. You still have to do a ton of stuff for if you're a caregiver, there's still a long list of things to do. At least take the medication off your plate. You're confident, right?
Mm-hmm.
It's oh, mom went to the doctor and they put an antibiotic order in. You don't even need to call us. It's going to be there. You don't please call us. That's great. We would love to hear from you. But it's going to show up in the car, because we've devised a system, and we know it's well, this is urgent. You can't wait on that. You need to take that right away. And this is what I would do for my mother.
Yeah.
This is what I would do for my father. And that's what I would expect. That's what I expect from our team and what we do. Because that's what they deserve.
Plain and simple.
Yeah.
There's so much to talk about with what you do and how you've helped this area, this community. But we're running out of time. So you're going to need to come back in here again, maybe do your own podcast, get that off the ground, have you tell all the stories about.
I have plenty of them.
I'm sure you have stories.
I don't know how many they're appropriate for your podcast.
No,
Can we do that?
This will be your podcast.
Okay, my podcast.
There you go. But Adam Rosinski, thank you so much. Custom Care Pharmacy is doing a bang-up job, and we appreciate you being here.
Thank you. I appreciate the opportunity.
You got it, man. Take care.